Now, the treatment of breast cancer is based on the stage. This is why it is so important. And I cannot say it enough. Whenever I give this presentation, I always like everybody in the audience to remember this or memorize what I'm going to say. Lucy, anybody here named Lucy? Anybody named Lucy? Can you raise up your hand? Okay, so I will not offend anybody. Anyway, if you are named Lucy, it's usually spelled L-U-C-Y. Is that correct? Okay, now the Lucy I'm talking about is spelled S-U-C-I-E. So that's different from the typical Lucy as a name. Lucy is the word that I ask you to remember because it's a female name and again helps to relate to what we're talking about. It stands for L, lead, U, us, C, catch, I, eat, E, Ellie. Let us catch, eat, Ellie. Can we say Lucy? Again? Lucy. And what did I say it stands for? Let us catch, Ellie. Thank you very much. If you did not hear anything else that I said here this morning, please go home with that. Please share that with your relatives, your friends, your mothers, your sisters, your brothers, your fathers, your uncles, and the people at your church and in your community. If you will follow the things that we are talking about here, and some of the other presenters will also talk about it, we would have removed the biggest challenge that we have in dealing with this disease. If we can catch it early, the curative rate is almost 95%. Let us catch it early. And that means you do your monthly breast self-examination, go to see the doctor once a year, and all the other things we talked about. So the status is not any more important. As I said, the pathological type, the anatomy, the size of the breast, and that next one. So I put this one just to illustrate the point that I just made. If you will cooperate with taking care of yourself, whether it's the risk factors that we talked about and all your monthly self-breast examination, we'll be able to catch it early. And you can see that when we catch it at stage 0, the 5-year survival is 95%. I have one of my good friends who we have given us the opportunity to participate in her care, and I call her Madam Survival. She was kind enough to come with me this morning. I just told her about it yesterday. She's the 5-year survival of breast cancer. And at the end of it, if we have a little bit of time, I would like her to share her brief testimony, maybe 1 or 2 minutes, just to encourage all of us. So that is the message I'm saying out of this. If we let it go too long, by stage 5, it's only 7%. So I think if your child, like these children that are in the school, if I ask them what percentage they would like to get, I think 95% their parents will be happy with. And that comes about doing those things. Next slide. So these are the alternative surgery, radiation therapy, chemotherapy, immunotherapy, or targeted biological therapy. Again, none of those are very important. The important thing is for us to do the things we want to prevent, as far as risk factors that we talked about. When it does happen, 2, to catch it early, and 3, to come to see the doctor. You don't have to worry about that. The doctor will determine based on what it comes on. Next slide. So, purely on surgical basis, we divide the breast into quadrants. And based on where the lesion is located, about 50% of the breast tissue is in that what we call outer upper quadrant. Because of that, most of the breast cancer, of course, as you can see, is 50%. But there is also another high percentage, which is this 18% in the mucoalveolar complex. So it is on the basis of where the lesion is, where the cancer is, we determine what type of surgery to do, and this just shows you a distribution and where we commonly encounter the next slide. These are the different types of surgery that we do. Again, I don't want to bore you with that detail. Lumpectomy, quadratectomy, modified radical mastectomy, or total mastectomy. These days, we really don't do much of total mastectomy. We do modified radical mastectomy. Some of the people that are here have undergone mastectomy. They're going to tell you about it. Again, it's not important. The message is here. What can we do to take on the challenge? Next slide. So, what are the challenges in Nigeria? That's the second part of what I came here to talk about. Next slide. Now, I usually use this slide to illustrate the major issue of attitudes and myths. This is one of the biggest challenges I find that we have in Nigeria. There are lots of wrong attitudes and or myths or wrong beliefs about cancer all over, and in particular breast cancer. And those are really causing us a little bit of difficulty. I have at least 3 patients that have done biopsy on them. The biopsy show that it's breast cancer, and they say it's not my portion. They refuse to accept care. They refuse to accept that they have breast cancer. One of them actually works close to where I work, and I see her almost once a week. So these attitudes and these myths about breast cancer causes us quite a problem. The best way I could illustrate it, that young girl says she hopes that we find the cure for breast cancer before she grows her boobs. Well, that's a good idea. But we don't know what is going to happen in the next 18 years when you will grow your boobs. So it is a wrong attitude about it. Now, this illustration hopefully tells us there is a little rat or mouse. They are feeding comfortably. They actually live in the house. You see, they are provided food. And here comes the other occupant of the house, the cat. And eventually they get together. Eventually, actually, the mouse or the rat gets out of the place, can't eat anymore, trying to run away. They get pretty close. And I'm sure you've seen this illustration about before. Say nothing, hear nothing, see nothing, and do nothing. Well, if we do nothing, that rat or mouse will become meal for the cat. And that is the message about breast cancer that I want to show. This myth that is not going to affect me, it is not my portion, or it is not breast cancer, it's something else, it's your idea, will be wrong. And the end result is the death risk that we have because of the advanced stage that goes to before we come. Next slide. The trend in cancer mortality, it is important to keep this in mind, and that's why I've highlighted it. In more developed countries, we actually find that the cancer burden that they have is projected to decrease. It decreases because they are taking those preventive measures and early identification. Lucy, as I said, and theirs is decreasing. However, when you look at the low income and middle income countries of the world, of which Nigeria is one, our incidence is actually increasing. It's increasing because of those myths and attitudes, but also because we are getting better information, we are finding out more. I'm not sure there is more of it, just more people are coming to healthcare and we're able to identify it. Also, the mortality in less developed countries is projected to increase. However, by 2030, approximately 80% of all the cancer deaths in the world will be happening in the low to middle income countries. Nigeria is one of those. We have a problem. And just like we dealt with Ebola, we recognize it as a problem. The whole country got together, did what should be done, and today Nigeria is Ebola free. Is that true? Yes. We praise God for that. We thank God for that. But it took deliberate action in the part of from the presidency to the people on the street for us to get there. We need to keep this in mind. That is what is going to take about breast cancer also. Next slide. The increase in cancer mortality in these low and middle income countries is largely due to delay in accurate diagnosis. That takes me back to Lucy. Let us catch it early. Next. Lack of awareness or lack of unawareness of the cancer and the potential value of therapy. This is one of the, I illustrate with 2 of my patients actually. One of them that we did a biopsy found out that she has breast cancer and she decides not to accept it. Because of that, she will not be coming to treatment, and therefore the actual potential benefit from therapy or treatment, she will never know. So, next slide. Also, access and ability to deliver potentially curative therapy. It's not just a matter of access. I think your Commissioner of Health, who's a good friend of mine, and our governor has done a great job in establishing health centers in every local government area, from what I understand. Correct me if I'm wrong. I am not sure all of them are functioning yet, but at least it's a good starting point. Therefore, in your community, whatever community you live in River State, you ought to be able to access care, at least the preliminary stage of it. When they see you at that place, they don't have a mammogram, they don't have all of it. They will then send you to BMH. Is that correct? Correct me if I'm wrong. So, access to care, ours is a little improved, but it still requires you and I to come from our house to go to that clinic and be identified that we have a problem that needs to be dealt with. So we have a problem of access. Then ability to deliver care is one of the areas that we are lacking. As I said, those healthcare centers don't have mammogram, so they cannot screen you to see if there's breast cancer or not. And if they get the mammogram, many of those centers, including BMH, may not have the chemotherapeutic regimen that's required to treat breast cancer. At least if we know that's what we have, then we can begin to work towards it. So those are some of the challenges that we're having. One, poverty is clearly related to many of these diseases, and cancer in particular. And being in the low income and middle income countries, such as Nigeria, that is part of our challenge. Again, access, cost of care. I understand that a session of chemotherapy costs about 150,000 naira. Now, I am not sure how many people can afford that in a 6-week period, which is about what length of time it takes. So we have a cost issue. Those notwithstanding, there are things you can do something about, there are things you cannot do anything about. I am trying to preach and pontificate on what we can do something about. Next one. They started the chemotherapy or whatever, but they needed radiation therapy, and they will not show up again because they go to their pastor, and their pastor said to go to their pastor, like, drink all this water and do in the name of Jesus. Well, Jesus is not asleep, okay? He did not go on vacation. He knew you had breast cancer. So I am pleading with us that we need to educate our priests and our pastors and our reverends, whatever, and our allergies or whatever, that when we have come across the real physical things that happens in life, let's recognize it as such. Let's not deny it. I remember I went to Katsina to do a medical mission, and we saw a lady. If you remember, the nurses wear this, what do they call, buka, that overflows and covers everything. When she raised up her buka in the presence of her husband who was there, I could not believe breast cancer that was already ulcerated. She had a terrible sting when she came into the room. What am I saying is that when I asked her, she actually went to the hospital. She was diagnosed with breast cancer. But the allergy told her, no, don't go there because if they touch it, it will spread and you will die. Well, cancer will still spread, she will still die, whether she can scream it or not. But these are some of the attitudes that create the challenges we have in our environment. So I'm pleading with you, please, let's educate our community, take this message home to your allergists, to your reverend fathers, to your priests, to your pastors, to your neighbors, to your chief, and whatever. That when we have come or when we have one of these symptoms, we need to approach care, access the care that we have, let the doctor evaluate, determine what it is, investigation is necessary so that we can determine what to do. At least, if I'm going to die, at least, if it's possible, I'd like to know what I'm dying from. Yes. Okay? So after that, I can decide if I want to pray about it, and that's perfectly fine. I can trust God and take what comes. But I am only pleading with you that we need to investigate, find out what is wrong. If after you find out the breast cancer, you don't want to do anything about it, that's perfectly fine. It's your choice and you have that right. Next slide, please. So the socio-economic status, I've already talked about it. If you simply look at breast cancer incidence per 100,000 population, if you look at the map of the world that is there, you are going to find that we are not that bad. Nigeria here is in yellow, which is about 36. If you look, for example, at the United States and Australia, it's over 178. That is a relationship of about 5 to 1. 5 to 1 to our favor. However, because of socio-economic factors, if you look at what Nigeria spends on healthcare, it's here. What the United States or Australia spends on healthcare is here. That is a 50 to 1 relationship. So this is part of the challenge that we have, that we do not spend enough money in prevention, education, treatment, and research in the low-income and middle-income countries of the world. And the net result is the same stage 0 that we found in Houston, Texas. The result of treatment compared to stage 0 in Port Harcourt, Nigeria will be different. And the relationship is what I've just shown to you here. What am I saying? I'm saying because of socio-economic status, which is one of our major challenges, even though our incidence is not as bad, our death rate is much higher because of socio-economic factors, one of our major challenges. Next one. So we need to look at it in the broader societal context of it. Our healthcare system has a part to play in the challenges that we have. The National Cancer Control or Prevention Program, which at this time we have almost non-existent, not just in Nigeria, but in most of these countries. But the message, again, I want you to take home, is when primary prevention fails, early detection will lead to curative therapy, which will lead to survivorship. Early detection will lead to curative therapy, which will lead to survivorship. Even though we have those challenges, I am not sure at my age I can make 5 million naira per month to improve my income. Maybe I will or something. But because I cannot do that, if we will still do the other things, I will have a chance at curative therapy, which leads to survivorship. So, in conclusion, I want to put this together as to what we talked about. I will survive. That is the message that I want to preach here. We can survive. Next slide. However, the patient, next slide, must come together with the physician, next slide, and the disease, next slide, in order for us to survive. Next slide. When we do that, then you see what is flashing in the middle, we have a good chance at it. And that's the purpose of this symposium and this conference that you have come here. Hopefully that's the message you take to your parents, to your churches, to your mosques, to your relatives, to your villages. Next. And with that, it however requires all the things I've talked about. The patient, the family, the doctor, the nurses, the investigation, the diagnosis, medication, and surgery. That is what is required. Next slide. So finally, I'll come to the monthly breast self-examination, which is the final point I wanted to make. Again, because I have seen several videos that they are going to show, I decided to skip that. Next slide. And those were the last things I was going to do. The breast cancer survival comments, I will leave that to the program people if you have time. As I said, my Madam Survivor is here, and she may be able to share that. Next slide. Thank you very much.
Ladies and gentlemen, that was Dr. Bernardo. Once more, please give him a big round of applause. So can I don't know the meaning of Lucy? Who came late? Is there anybody that came late here? You don't know the meaning of Lucy? Can I see your hands up? You don't know the meaning of Lucy? Really? Okay. Your hands up. Still put your hands up. Okay. Madam, you know the meaning of Lucy? No need now. Tell her the meaning. Madam, is it? Once more. I heard you. So you know it now? So say Lucy. Good. Alright, sir. I think everybody got the message. Everybody got a very important lesson. But I want to believe there's one or two questions we need.
And I would like to ask this question. is it in every situation that the breast must be amputated in a case where an individual has breast cancer?
The table has decided that we will take all the questions. Kindly give them a piece of paper to write it on so they don't forget. At the end of all the presentations, we'll take all the questions. Please. Thank you.